Okay. My name is Alexandre Marra. I'm a professor of the post-graduation stricto senso program in health sciences at Albert Einstein Instituto Israelita de Ensino e Pesquisa, and also I'm a researcher at the Hospital Israelita Albert Einstein. I have been doing research at the University of Iowa, Internal Medicine Department in Iowa City, Iowa, for almost 7 years. I'm really excited to introduce one more presentation in the Einstein Connection series of guest speakers. Now we are celebrating 1 year. Einstein Connection is our international program that intends to connect Brazilian researchers, students, and healthcare personnel with international professors and international researchers. It's my pleasure to introduce our guest speaker, my friend, Mohammed Alsuhaibani. He's also the Associate Professor of Pediatrics, Pediatric Infectious Disease, in Qassim College at Medicine. He's certified in infection control and epidemiology. Dr. Alsuhaibani performed infection prevention and control and antimicrobial stewardship fellowship at the University of Iowa Hospital and Clinics. I have been honored to have Dr. Alsuhaibani as a friend at the University of Iowa, and it's been rewarding to see Mohammed collaborates with international projects. He'll talk to us about small world, different experiences as a hospital epidemiologist and as a pediatrician. We have planned for Dr. Alsuhaibani to speak for 30 to 40 minutes, after which we'll have 10 to 15 minutes to answer questions. You can unmute yourself and ask your questions after Dr. Alsuhaibani's talk, or you can type your question in the chat. I'd like to ask all of you to answer the survey at the end of the presentation. Thank you, and I will now hand it over to Dr. Mohammed Alsuhaibani to start. Mohammed, the floor is yours. Thank you very much.
Thank you. Thank you so much. Hello, everyone. Actually, I'm very glad that to present this presentation about my experience in pediatric infectious disease and in hospital epidemiology. Thank you so much, Alex. Thank you for also your center for inviting me to do this presentation. I am Mohammed Alsuhaibani, medical doctor. I am pediatric infectious disease physician and hospital epidemiologist, associated professor of pediatrics, working currently in Qassim University, Saudi Arabia. I have no disclosures. In brief, I want to just talk about my medical training timeline. I have been graduated from Qassim University at 2010. It's kind of 7 years medical school, and my medical school was kind of unique because of the education system. It's been like a new education system. We call it PBL, which is problem-based learning education system. So it's not the traditional medical education, it's a problem-based learning. And it is 6 years, 3 years in basic science, then 3 years in clinical science, then after that 1 year internship training in different hospitals. After that, from 2010 up to 2015, like I did my residency program, which also done at King Fahd Medical City in Riyadh. It's one of the biggest medical center in Saudi Arabia, and it's including children hospital with different subspecialties. I did 4 years there. After that, I joined King Faisal Specialist Hospital and Research Center, which is one of the best hospitals in the Middle East. And we will talk about this in after a couple of slides. I did a fellowship in pediatric infectious disease there for 2 years from 2016 and 2018. It's kind of like a very advanced center with transplantation services, also hemato-oncology services, and I did there 2 years. Then after that, in 2019, I joined University of Iowa Hospital and the Clinics, and I did my training there in infection prevention and control and antimicrobial stewardship for 2 years. I would talk initially, just I will give like a brief idea about what is Saudi Arabia and where is Saudi Arabia. Saudi Arabia and it's officially the Kingdom of Saudi Arabia, and it is a country in Western Asia, and it's the capital of our country is Riyadh. And our currency is like Saudi Riyal, and the population is now it's almost like 34 million. It's one of the G20 countries, and there's a lot of like medical centers in Saudi Arabia. The healthcare system in Saudi Arabia, we have like the private sector, and also we have the governmental, because the government like providing the service, the medical service for the citizen, for the people in Saudi Arabia, citizens and non-citizens. So it's the Ministry of Health, and also there is other provider for the medical care, including like teaching and university hospitals, military hospitals like National Guard and Armed Force Medical Center, Security Forces Hospital, also Aramco Medical Service. Aramco is one of the, actually it's the biggest oil company in the world, and they have their also medical service. They have, it's affiliated with Johns Hopkins. So they have their Johns Hopkins Aramco Hospital in the eastern of Saudi Arabia. In the Ministry of Health also, it's providing also a huge medical service. It's up to 60%, and it's including the primary care, which is like a small center that providing, you know, the simple medical service plus vaccination and like follow-up for the chronic diseases. Also the secondary hospital and tertiary advanced center, like a transplant center and also oncology center, or yeah, I mean very advanced center for, which is the tertiary care center. Also, in Saudi Arabia, every year we have 2 million Hajj pilgrims. They are coming to Saudi Arabia to visit Mecca every year, and our government did really great efforts to accommodate those people, and usually I mean those 2 million coming from every aspect of the world, and the government here, they usually make sure that they are providing the best services and the best care, and make sure that everything done in the correct and safe way for them. So this is why I'm talking about this, because it's really, I mean, touching our specialty, which is the infection prevention and control. And just I want to do, I want from you to compare. This is the usual in the right slide when the people coming for Mecca to do the pilgrimage, and here after COVID-19, when the government they decreased the number of people, and they actually they like implement many precautions to make sure everything is safe, and also to prevent, you know, with the COVID-19, to prevent to prevent outbreaks because of the mass gathering. So a lot of efforts done every year to accommodate the pilgrimage to Mecca. Also, there is a recent publication about what the government did, and in the Journal of Travel Medicine, about the Hajj pilgrimage during the COVID-19 pandemic, event hosting without the mass gathering, what they did, how they, if someone interested, he can also see, he can refer to this paper and read it about what precaution have been implemented to prevent such many outbreaks in the Hajj. So regarding the medical research centers in Saudi Arabia, which is, I believe it's also part and very important of this presentation, we have many research centers. I will talk about the biggest two. And if someone he want to collaborate with this center, currently I'm working with King Faisal Specialist Hospital and Research Center, and I'm willing, if someone just want to connect with them and want to collaborate, he can also visit their website because they have different departments, including biomedical physics, cell biology, but I mean, different specialty, cardiovascular, stem cells, environmental health program, everything. So if someone interested in whatever specialty and want to collaborate, want to explore more, you can feel free and contact me. I can help him. Also, he can visit the website and read more about this research center. The second research center is King Abdullah International Medical Research Center. This is also with National Guard Hospital, and also they have different research and development departments, including the research about the blood and cancer, diabetes, cardiovascular diseases, infectious diseases, and also the rare and genetic diseases. So if someone also interested, he or she can visit their website, and also if you want to connect with them, there is an email that you can connect with them, and if you want to do collaboration, I believe that they are willing to collaborate with if something interested for you and for them. My specialty as a pediatric infectious disease and adult infectious disease, there is some differences between pediatric and adult. For example, actually, I take this table from one of the Australian study that they compare between the pediatric and adult infectious diseases. And in pediatric, for example, in adult infectious diseases, the diabetic patient is more, HIV patient is more, but for example, the CNS infection is more in pediatric, cardiovascular patient more also in adult. Viruses representing bulk of the diseases in pediatric specialty. Also, referring specialty is different from pediatric to the adult. Very important also that some of antimicrobial is restricted in pediatrics, so we cannot use it in pediatrics due to the safety issues. And some also there is differences between pediatric and adult in the route and the duration of antibiotics. So here is some differences between pediatric and adult infectious disease. If someone wondering what is pediatric infectious disease and is it different from adult infectious disease or not? So yes, there is some differences. During COVID-19, I was doing my fellowship at the University of Iowa in infection prevention and control. Actually, the COVID-19 was like kind of a practical like lesson for me during my fellowship. I did at our fellowship also we did a research about the impact of COVID-19 on infection and prevention program in Iowa from 2020 to 2021. We compared how was the infection prevention and control program working before and after the COVID-19, what was the load, and this was done by me and my colleagues at the University of Iowa Hospital in a clinic. Here you can see in the blue there was this is usually the load of work, the load of calls. Actually, we are comparing the calls. Sometimes if someone like want to want to consult the the infection prevention and control program, we compared the number of calls just to see how was the load between those two periods. And we found that you can see here after COVID-19, the number of calls increased dramatically and over the 2 years, and the number of also the number of calls increased. It was like from 100 to 120 before the COVID-19, and increased up to sometimes in some months 600 calls per month, which is a very high number. Also, during my work at COVID-19, during my work at COVID-19 period, we did also many publication, including COVID-19 and non-COVID-19 work. So we did it with together as a team with our colleagues from the University of Iowa Hospital and clinics. Also, during our work, we shared in a couple of conferences, and our research, which was the coronavirus 2019 COVID-19 admission screening at Tertiary Care Center Iowa 2020, was selected as one of the top oral presentation at the SHE conference, which is one of the biggest conference for the infection prevention and control. And also it's been published in Infection Control and Hospital Epidemiology journal. And so in this, actually briefly, I mean, in this study, we just did we compare the infectiousness of patients who were admitted due to COVID-19 for non-COVID-19 reasons, and we assessed the infectiousness by using the CT value and multiple factors as well. And it was like at the conclusion of our research that we found that 42% was likely infectious and 58% was likely non-infectious. And this also it has its impact on the hospital stay, in addition to the impact on also the costs of the cost. So yeah, this patient, this research has been published recently in each journal. In this book, which is my favorite, Pediatric Infection Prevention and Control book, they mentioned that children are not just small adults. So when we deal with children in infection prevention and control, we usually make sure that from like some points that, you know, it's different from pediatric to adult population. So there are like multiple risk factors for healthcare associated infection in children, which is sometimes different from adult due to the behavior of pediatric age group, due to sometimes the visitors coming to pediatric patients, also their family, some also physiological and some immunological causes because of the age. As you know, there is, I mean, sometimes in pediatric age group, especially in neonatal ICU and in the also playroom or play areas, it's a little bit complicated to control the infection prevention and control measures, and it needs really to focus in the basics first. For example, the hand hygiene and those things, and also there is like quite different things between the pediatric and adult, especially in the central line care. For example, the chlorhexidine safety in pediatric, there is some issue in some age groups. Also caring, about pediatrics, controlling the pediatric age group, hand hygiene is a little bit, will be sometimes an issue in pediatric age group. But usually we recommend to focus in basics of infection prevention and control, either in pediatric and adult. And we should also look to the different, the small difference between the pediatric and adult, and modify some of the infection prevention and control in pediatric. Also, it's very important in pediatric because I would say it's the main role of preventing like infection in pediatric is to make sure that the kids in the community receiving their immunization, and make sure that those kids also they are they receive the vaccination and immunization in the correct time as well. So we talk about this, about the caring of central line and also the chlorhexidine and others, and the risk factor of the infection in pediatric. In pediatric, there is like certain references and certain papers that I would really highlight and comment on. Here is a recent paper of which has been published in the infection control, the H journal, which was about the neonatal intensive care unit white paper series, the practical approach for the prevention of central line associated blood infection. It's really very great paper for if someone like interested to read. It's kind of questions and answers for some procedure, and also it's very and some also issues in caring for pediatric with central line and with central line also associated bloodstream infection. including taking care of these lines, including the lock therapy, and also and also several issues that has been included in this paper. Also, this is quite recent paper published 2017 or 18 in American Academy of Pediatrics, and it's really a great reference in general for infection prevention and control in pediatric ambulatory settings. So it's very basic and very important for anyone taking care of infection prevention and control to read this paper because it's really very helpful. Also recently, the group of infection prevention and control and hospital epidemiologists, they put like some pediatric research priority in healthcare associated infections and antimicrobial stewardship. And I want to share it with you if someone interested to do a research. They actually put like many topics that ranked from the high priority, which is the diagnostic stewardship intervention for Clostridium difficile, chlorhexidine bathing to decrease the multi-drug resistant organism acquisition in hospitalized children. Also developing a metric to define the hospital onset bloodstream infection. Also, there is the low feasibility but high impact research, like the surgical site infection prevention for specific high-risk pediatric procedure. And they like mention these procedure like VB shunt, spinal fusion, and also cardiothoracic surgery. And also the molecular epidemiology and transmission dynamic of multiple resistant gram-negative rods in critically ill children. Novel central line associated bloodstream infection prevention bundles for high-risk pediatric population. Also the beta-lactam allergy delabeling a low-risk outpatient. Also the judges' use of perioperative antibiotics and the shortened duration of antibiotic therapy for the common bacterial infection. Also the increased use of oral instead of intravenous therapy. Also develop patient-level harm index of antibiotics, benchmarking and peer comparison of antibiotic use for common inpatient conditions. All of these topics is really priority to do a research in pediatric age group, because what I noticed during my fellowship, you can find a lot of papers in adult population group, but in pediatric age group still we need more paper and also more research to answer several questions. Also, in general, if someone also interested in pediatric infection prevention and control resources, of course, CDC, American Academy of Pediatrics, the European CDC, WHO, and the Society of Healthcare Epidemiology of America, also EPIC, all of this organization is excellent references if you have any question or if you want to ask about any, if you want to look for any pediatric infection prevention and control issues. Thank you so much, and please feel free if you have any questions. And here is my email. If you want to contact me, you can contact me anytime if you want to, like, as I mentioned before, have a collaboration in pediatric infection control or pediatric infectious disease. We are willing in our center, and I believe that also we can and you can be. We can do really, a lot if we can collaborate together. And thank you so much.
Thanks very much, Mohammed. I really appreciate your talk. It's pretty good, fantastic.
Thank you.
And I like very much to see the introduction about the healthcare system in Saudi Arabia, because for us, it's different, you know, and to understand the timeline of your career was really important. And thank you very much for sharing it with us. Considering your expertise as infectious disease pediatrician, how was the situation in 2013, 14, considering the MERS-CoV? Because now we are in the COVID-19 pandemic, but I learned a lot with you, Mohammed, Alsuhaibani, Abdullah, Mufaha, Harkitiri, about MERS-CoV, because in 2015, 2016, a lot of people talking about MERS, but nobody imagined that we have in the future another coronavirus causing severe disease like COVID-19 infection for the new virus SARS-CoV-2, and now you have the new variants. How was the situation in that time for pediatric population and right now?
Yeah, actually, during like 2014 and 15 and MERS-CoV, the rate of infection in pediatrics was really, I mean, very limited and very low. And also the transmission of MERS-CoV compared to the COVID-19 was very, very low. And also the mortality rate was also higher in MERS-CoV compared to also to the COVID-19. However, the transmission was not that high. The pediatric population was not not affected too much by the MERS-CoV as it's affected by COVID-19. If I compare, because I lived the situation of H1N1, for example, at 2019 to 2010, it was during my internship. And I remember that the pediatric age group was really affected by H1N1. And I remember that we kept like one ward in the hospital only for H1N1 pediatric patient. Also, the mortality was a little bit, the morbidity and mortality and the admission rate to the hospital was a little bit high with H1N1 at that period. We didn't face these things during the MERS-CoV in pediatric patient. I'm not talking about adult patient. Of course, the adult patient, they were affected. There are multiple factors why this happened in adult, not in pediatrics. However, yeah, I mean, of course, we lived this situation, but it was mainly in adult in MERS-CoV than in pediatrics. But it was really, the pediatric age group was really affected more by H1N1. I'm talking about like 2015 and before that. Then, you know, COVID-19 came and it's affected the pediatric and adults, both.
Oh, wonderful. Mohammed, I'd like that you explore a little bit more about your expertise in systematic review and meta-analysis, because in Einstein Connection, we have like researchers and students doing post-graduation that they are learning or they are working in this study design using systematic reviews and meta-analysis in their researches. And I'd like to know about that and about the possibility to collaborate with you in the future in these research projects.
Yeah, actually, I was, I mean, I started doing the meta-analysis and the systematic review during my fellowship at the University of Iowa Hospital and the clinics. I recommend, everyone want to start, he should know the basics of doing systematic review and meta-analysis, because it's very important to know the basic things before looking for a topic or starting the work. There is also a lot of resources nowadays, including YouTube. I mean, if someone interested to know about some certain some certain information about meta-analysis and the systematic reviews. The chance of collaboration, of course, is there. If someone interested, we are welcoming. I mean, I would be very interested if the idea about pediatric pediatric infectious diseases or infection prevention and control in general, adult or pediatrics. Yes, I mean, it would be a great chance if we can collaborate, or if someone want to collaborate with us. We published, of course, with Dr. Alex several papers about the systematic review and meta-analysis, and also still some papers also under processing.
Oh, thank you. Yeah, and only to emphasize that Mohammed is working with us, with a couple of medical students at the Medicine Einstein, doing systematic review and meta-analysis since November 2020. And we are not studying the pediatric population, but I think that's a good opportunity if you have pediatricians in the chat. And we are working in topics related to COVID-19 vaccines. And it was a very interesting experience for me, because that's my first time that I'm guiding medical students outside Brazil. I'm in Iowa, and the students are in São Paulo, and we are establishing connections with Mohammed in Saudi Arabia. And I think that we did a good job, Mohammed, using the Zoom or WhatsApp, emails. We got to have a plan for these studies, and we made what is the idea? We discussed this. We did our data abstract forms. We had couple of chats, and in the end, we got to finalize the paper with accepted papers, as you mentioned before. Thank you very much. I think that's a good idea. And use your talk about one of the interesting that you have about pediatrician and antimicrobial stewardship. We have a lot of pharmacists interested in research about antimicrobial stewardship. And as you mentioned, and I totally agree with you, there is a gap of knowledge about antimicrobial stewardship in this specific population, because the majority of studies are in adult population, and you are trying to considering, as you said, children is not a small adult. It's a person totally different from an adult. And I think that it's a good opportunity. I have every Friday morning, I have 1 hour of talk with a group of researchers in the pharmacy at Albert Einstein. And I think that it's good if you agree. In a couple of weeks, I can invite you for a meeting about that, and we can establish a collaboration to start a project with these pharmacists. If you are interested, I think that we can start a collaboration with not only with medical doctors or medical students, but other professionals that they are really interested to work with us.
Yeah, sure. Of course, that's very interested to do, and also I will be very happy. I mean, to attend with you, and also we can think about also ideas to do in antimicrobial stewardship, because as you mentioned, there is a gap in pediatrics, especially in infection prevention, and also in antimicrobial stewardship. Like, for example, looking for short courses of antibiotics, looking for some specific doses of antibiotics. This is very essential and very important. And not only the ID doc, the infectious disease doctor, or the pharmacist actually playing very important role in antimicrobial stewardship. So they're going to be like a great help, and I would appreciate, this opportunity.
Me too, I appreciate. And another invitation for you. Every year in the Albert Einstein post-graduation stricto sensu program, we have courses about epidemiology. I coordinate with Dr. Lenza. It's another researcher at Albert Einstein. A course about epidemiology and study designs. And I think that we can use your knowledge, and I invite also Mohammed Alsuhaibani to talk about the study designs, like cohort studies, case control, systematic review. And I think it's a good discussion, and like basic things, and you can give your point of view about epidemiology, but also in pets population. I think that's very, really interesting.
Of course, sure.
I like very much about the research center because it's perfect, because EEP is a research center from Albert Einstein. I think that you can start a collaboration with your research center in Riyadh. I took note. I understood that there are two research centers. That's right, King Faisal and King Abdullah. That's right.
Yeah, that's correct. Yeah, I mentioned that actually there is a couple of research centers in Saudi Arabia, but I mentioned the biggest two. King Faisal is one of the biggest research center in the area, in the Middle East, I mean. Also the King Abdullah as well. So I would recommend, I mean, if someone like interested or want to collaborate, or like first of all, I mean, just to browse their website to see, I mean, if something like interested, some like specialty that you feel it's interested for you, I believe like contacting them and will be and like suggesting, for example, if you want like collaboration, or if you want to do, if you have any idea, if you have any questions, I believe that they will come all of this. And of course, I mean, if something like in my specialty, I would be very happy also to help in that and connect them with the people in research centers.
And I have one last question, because I don't have to take your time. I really appreciate that you are here with us in São Paulo, Brazil, using this Zoom tool. We are doing in Einstein a collaboration study. It's a multi-center study considering the COVID-19 vaccine effectiveness. We have a database about healthcare workers, but we can expand this for other population. But our focus is healthcare workers. Considering your expertise in Mohammed and Abdullah, I know that they are studying this too. I think that we can share maybe data to make this strong, because in Brazil, the primary doses for COVID-19 vaccines were CoronaVac and AstraZeneca. The third dose, the booster, was Pfizer. And maybe we can share, because I know that in Saudi Arabia, like in Brazil, use the heterologous vaccination. It's not like in US, like homologous, Pfizer, or Moderna. We mixed this, and now we are having good results showing that the heterologous vaccination can promote more neutralizing antibodies, and the breakthrough infection is lower if you compare homologous vaccination. I think that it's a good opportunity because we can understand more these new variants, and Saudi Arabia is a really unique region because I don't know if you have co-infection cases about SARS-CoV-2 and MERS-CoV, but we have like 2 coronavirus in the same place, and this is really unique, you know.
Yeah.
And
yes.
I think that we can use this experience and merge our data.
Yeah, of course. I mean, of course. And I totally agree with you. Merging data together and to experience will make it, I mean, stronger and better. In our country, actually, they used the heterogeneous vaccines. For example, if someone like received AstraZeneca, he can receive the second dose was like as a Pfizer or vice versa. But some of them they received I mean the homogeneous one, so they received like 3 doses of Pfizer or like 3 doses of Moderna, or so I believe yes, there is data about it, and of course, I mean, if you think that will be helpful, we can discuss this further.
Wonderful. Well, thank you very much. I have here Dr. Alsuhaibani in our Einstein connection. If I have questions in the future, if you receive by email, I can send to you if you don't mind, but I try to do my best to answer all the questions. And I will send you an email for the invitations for the pharmacy department and for our course in the next year. But of course, that we will discuss your availability because of the different time zones. Let's say I just said, do you want to ask any question to Mohammed, or do you receive any question?
Sorry,
yes.
Alex.
No, I asked you for the coordinators from the Einstein connection if you have questions, but for a while we didn't receive any more questions. And thank you very much, Mohammed. I'm really glad to see you again. And please, let's keep it in touch. Yes, we are talking every week through the WhatsApp, but let's take a moment to see you again. I hope to see you again in Zoom. And see you next week in your infection control conference in Riyadh. Thank you very much.
Yeah, see you. Thank you so much, Alex, and thank you for the attendance. I appreciate it.
Thank you.
Thank you.